The next section would be the withdrawal times for milk. And again, it's a VRCH guideline 48. The study design for the milk, we would use 20 lactating animals, high-yielding animals at early lactation stages and low-yielding animals at late lactating stages. Intramammary administration would be given at all 4 quarters. For dry cows, also minimum of 20 animals would be used. The treatment should be consistent with the desired pre-calving interval for the dry cow period, so that sufficient number of animals give birth in a limited time interval. This is for the study design for the dry cow treatment. You would start with 20 animals, but you are not sure that 20 animals are calving in a certain interval that is desired for the product. And 4-quarter composite samples are collected from the individual cows at each time point. So you would treat 4 quarters and collect the milk from 4 quarters. And typical collection interval would be 12 hours. So treat 20 animals. For intramammary treatment, treat always all 4 quarters. For all animals, if treated intermammarily or not, use the composite sample as the milk sample and use a 12-hour milk collection period. This is the standard study design for milk residue depletion study. Number of animals is higher because it's easier to collect milk than to sample tissues. So, this will be covered later by Miguel, so just very shortly. So for the assessment of data, you have, in principle, 4 assessment methods. 3 of them are based on statistics. This will be explained by Miguel. And you have still the alternative approach, which I explained previously, that this take the time point where all residues are below the ml and add a safety span. This is a milk depletion profile. So from different cows, individual cows deplete quite similar, but also differently. And the withdrawal time also here would be the 95% tolerance limit. And although this will be explained later by Miguel. And also here we have the problem of 0-day withdrawal times. And also for milk, there's a big incentive for companies to have a 0-day withdrawal times, because farmers do not like to discard any milk. They want to use all milk that is collected. And so there's a big marketing advantage for products that have a 0-day withdrawal time for milk. And the companies are very keen to show that the withdrawal time for milk is 0. So the recommendation to obtain a 0 withdrawal time for products administered at 1 or several treatments or continuous treatment when residue has reached a steady state. A limited time point study may be sufficient to qualify for a 0-day withdrawal time. Sampling for a 0-day or nil withdrawal time should cover the earliest possible time points of post-treatment milkings. And for these time points, local difference can vary from as short as 6 hours, 4 milkings per day, to every 24 hours, 1 milking per day. So as this is a VRCH guideline, it should reasonably cover also the milking schemes in the different region. And this was a very long discussion. And the following study design was recommended for drugs that may qualify for a 0-day withdrawal time. This is the study design from the VRCH guideline. You would treat cows. The total number is 16 cows. You would treat them. And you would collect milk at 6 hours from 3 animals, collect at 12 hours, collect at 8 hours, also 3 animals, and collect 3 animals at 10 animals at 12 hours. And here again, the next time point would then be 12 hours. And from the samples for 6 hours, 8 hours, and 12 hours, you would conclude if the withdrawal time is 0 or not. So 0 was decided by Japan. They wanted to have 0 withdrawal time because they thought it might happen that you treat the animal and then you milk 6 hours later. And then this might be the highest concentration on the basis of residues. So, and this would not be covered if you only collect milk at 12 hours. So if you use this scheme, the 16 cows, and this milking scheme for the 12 hours when it's collected already at 8 hours would not be analyzed, then you could check if the product would qualify for a 0-day withdrawal time. And treatment of animals is normally you milk them out, then you treat them, and you would collect milk at 12 hours. This would be the normal milking routine. And here on this slide, you can see that you treat the animals this is for 0-day withdrawal time. You would have Cmax, and then you would have the milking at 12 hours. And this milk would contain all the AOC. So this is again in situation 1, the same picture. If you treat the animals 6 hours before milking, you would only have part of the AOC. And also in situation 2, you would have part of the SPC of the AOC, and also in the second treatment you would have less residues. And also in situation 3, you would have not the full AOC. The European opinion was that if you treat an animal 12 hours before milking, it would be the worst case in terms of residues, because in this case, the milk would contain the residues over 12 hours, which is the highest amount of residues that can be present in milk. If you treat animals 6 hours before milking, there is already milk that does not contain residues, and it would dilute the residues from the 6-hour milking. So this is not the worst case. But nevertheless, we have accepted this milking scheme. For the European situation, it would be fine to show that after 12 hours, the residues are below the ML. So I would not ask for 6-hour milk. But there was a bit confusion in the discussion. Some thought, some experts were thinking that the peak residue would determine the concentration. And some were thinking that the AOC, so the excretion over time, would determine the amount in milk. And in my opinion, it is the excretion over time, over 12 hours, that is the worst case, not the peak, whatever the peak is.
Yep, excuse me.
So yeah, this is reflected here in this.
Yes, sorry, Stefan.
Yeah.
I agree totally that the important time it's 12 hours after the administration.
Yeah.
Because it would contain all the residue.
The highest amount.
Yeah. The highest amount.
Yeah.
And that's why we have 10 animal samples at that time point. We have 10 animals, so we can have a more rigid statistical calculation for that time point. Whereas the other time points, when you have a sample at 6 or at 8 hours, you only have 3 animals, which is kind of a confirmation that there will be no residues over the MLR on those time points. But the important one, I think it's the 12 hours also.
Also here in the situation 3, you would treat the animals maybe 2 hours before milking. This is only this portion of the AOC would be in the first milk, and in the second milk, this portion of the AOC. Only when you use this treatment regime, that you treat the animals after milking them out, 12 hours before milking, you have the full AOC in the milk. All others give you less residues. All other scenarios give you less residues. I was thinking a lot about this, and we had big discussions in this, maybe over a year. So the VSH process is very slow, because everything happens via email in the end. because it needs to be adopted by the working parties, by the authorities, and so on. So 0-day withdrawal time, to summarize, would be acceptable if the animal has been treated 12 hours before milking. This is quite tricky. This is for a compound that has a very slow depletion into milk. And actually, in this case, it might happen that treatment is here, that a farmer collects milk in this interval, maybe, where between the peak. And then you might have a situation in this case that the treatment, the 12-hour milk, the two 12-hour milks contain less residues than the milk that would be collected in 12 hours between in this interval, maybe. And in this case, you would check the concentration in this portion, in this sample, and in this sample, and make sure that the combined residues are below the MAL. And if the combined residues are below the MAL, in this case, also any milking at the farm in any interval would only yield residues that are below the MAL. So here is the example and the calculation. If you would like, you can recalculate this. So there might be some products where the milking interval in 12 hours does not cover a milking that happens maybe here in between. Because you never know when the doctor comes to the farm. You never know. In practice, in an experiment, you can treat the animals 12 hours before milking. But in practice, milking might be 2 hours or 3 hours before the next milking. You have to differentiate between the experiment. The experiment can be conducted under controlled conditions. You milk the cows out, and then you treat them, and then you collect every 12 hours. But on the farm, there may be a situation that the cow is treated and milking will happen. That a cow is treated and milking will happen 2 hours later, or 3 or 4 or 5 hours later. And also, what I would like to show with this slide is they have to check the first 2 milkings to make sure that the sum of the residues are below the MAL. Then you can be sure that any milking regime on the farm will not exceed the MAL. It's difficult to explain, and it's difficult to explain for me. It's difficult to understand. We discussed this for over a year, I would say. And this is the example that shows this. But in the end, this is what companies would present you to justify 0-day milk withdrawal time. And this is what would perfectly demonstrate in most cases a 0-day, a 0 hour 0-day withdrawal time for milk. So 0-day withdrawal time can be achieved based solely on this study design, provided that sufficient information is available to determine Cmax. And milk collection at 12 hours administration represents the maximum sample interval which may qualify for a 0-day withdrawal time. And it is strongly recommended that at least 4 additional milkings are collected following 12-hour sampling times to confirm that residues do not further increase. This is also important. So the residues in the first milking should be below the ML, and the residues should not further increase. And this is made sure if, in this case, you would milk a second time, third time, and the fourth time, and if all residues are lower than in the first milking, then it is 0. And if the first milking is below the ML. So a special aspect is the intermammary treatment. Treatment is given to all quarters. The test article is administered after the last milking, as I said. So for dry cow studies, there is a residue depletion phase 4 calving and a phase pre-calving. And in order to reduce variability, the study should be designed such that a sufficient number of animals give birth in a limited time interval. So if you want to have treatment interval before calving, maybe 40 days, you should make sure that a sufficient number of animals give birth 40 days after treatment. Is correct? Yeah.
Yes, it is correct. Yes,
Yeah.
we will see later that with the new software, this may not be the perfect approach, but I will tell and talk about this later.
So the intention is that the difference between the dry periods among the animals are kept as small as possible. And the idea is to have a sufficient number of animals for the statistical analysis. For instance, to target a pre-calving interval of 30 days, data should be collected from at least 20 cows. This is a typical number in the interval of 20 and 30 days after treatment, or between 40 and 60 days if the pre-calving interval is 60 days. So this normally would use more than 20 cows to have this. So it's very tricky to have to find the right study design, to have 20 cows in the desired pre-calving interval. It's up to the company to show this. If you have only 1 or 2 or 3 cows in the desired calving interval, you cannot get a withdrawal time based on a reasonable assessment. And how to express withdrawal times for dry cows, this is a long discussion, so Miguel knows more than me about this. So the withdrawal times for dry cow products after milk, after calving, are sometimes linked to the length of the dry period. In general, it can be expected that residues are higher the shorter the dry period. For shorter dry periods, there are more residues at the beginning of the milking than for longer dry periods. For many reasons, probably, compounds might be absorbed from the other, or might be lost to other, might be physically lost through the teat tips. Yeah, so all this might happen. So the longer the dry period, the lower the residues. This is an experience that we have made in many studies. So if a study has been conducted to target a pre-calving interval of 30 days plus X, the milk withdrawal time would only apply to animals calving through 30 days plus X after drying off.
That's it.
Yeah. So that's why it's very important to have the right study design. If you desire this, if the desired design is 30 days plus X, and all cows are calving 20 days before, all cows are calving 20 days after treatment, yeah, you cannot get the desired SPC. And for animals calving earlier, this might happen. After drying off, the withdrawal time would be longer. So if for this 30 days plus X, the withdrawal time is, for instance, 5 days. And if a cow gives birth 20 days before calving, gotcha.
It's kind of difficult to.
Difficult to.
Yeah, because you need to think in. So if in the SPC you have the withdrawal period expressed for cows that have a 30 days dry off period, then you will have the SPC will say for cows which have a dry off length of 30 days or more, you will apply 5 milkings withdrawal time or whatever. You will have to discard 5 milkings. But if the dry off length is less than this 30 days, then you will have to wait 30 days from the treatment, not from the dry off length. So from the treatment, you will have to wait this 30 days and then apply
Extra, yeah.
that X days.
Yeah.
We have 5 milkings in this case.
Yeah. And
So
this
that
is-
would be 30 days plus 5 milkings.
Here comes an example. The example cloxacillin benzathine formulation. The target dry period was 35 days or longer. So, and milk for human consumption may only be taken 108 hours after calving. It's not intended for use within 30 days of calving. If calving occurs before 35 days after the last treatment, milk for human consumption may only be taken 35 days. These are 35 days plus 108 hours after the last treatment. So in a case of a dry period of 20 days, would give a withdrawal time of 15 days plus 108 hours. So the 20 days plus the 35 days would
be a
have a
total of
withdrawal time
35
of
days,
15 days after calving, plus the milk withdrawal time. So that's what we're usually doing. And Miguel will present this afternoon probably a more elegant approach to this.
Yes, I mean, right now, as you said, some depletion of residues in milk might occur during this dry-off period.
Yeah.
And right now, we are not really taking that depletion into account.
Yeah.
So you will have the same withdrawal period for all the cows which have a dry-out length that is more than 30 days. They will all have the same withdrawal period, and if they have less than a shorter dry-off period, then you will have to apply this withdrawal time from the treatment plus that. So you're not really taking into account this depletion during the dry-off period.
Yeah.
And with the new software, this is the intention is to take this into account. But I will explain all this again.
Yeah. In the end, the farmer will be punished if the dry period is shorter than the intended dry period. We will get a very long period, a very long withdrawal time. So withdrawal periods for milk, first breeding pregnant animals when no ML is available. This is also worth discussing, though there's no guidance. So when there's no ML for milk, the general restriction is not authorized for use in animals producing milk for human consumption, including during the dry period. So, but occasionally pre-calving withdrawal times are set. So these are examples what has been done in the past. Where adequate residual data in milk are available, these were used to calculate the latest possible treatment time required to ensure that residues after calving do not exceed the ADI. For instance, for certain fungicides, the CVMP has estimated the time needed to ensure a total residue burden equal to a safe number of molecules in 1.5 liter milk. This is from the SPC. And this was based on pharmacokinetic models. So for a compound that has no ML for milk, the assumption was there should be no molecule in the milk. So the pre-calving interval was set at a time that there is no molecule of the compound anymore in the milk. You can calculate this. So in a mole of compounds, there are 10 over 23 molecules, and you can calculate this. This is, in a way, this is excessive, but this was done. And also we have examples which say do not use within X months, days prior to the first calving in heifers intended to produce milk for human consumption. And this is for some macrolides. We have the restriction do not use in non-lactating dairy cows, including pregnant heifers, within 60 days of calving. So the assumption is if you use it, if you don't use it 60 days within calving, the residues would be safe. There's no guarantee that there are no residues because you have no ML in milk. So we still, when there's no ML for milk, the assumption would be zero tolerance for residues. So for the fungicides, the CVMP has assessed this on the basis of no or one molecule can only be present. And for other compounds, this is for, I think this was doramectin. The CVMP has assessed that 60 days before calving would be a sufficiently long time to ensure that residues in the udder or in the milk are safe for consumers, without knowing what the concentration was.
Yes. Again, as he asked before, what it is safe, it's this concept of safe. When you do not have an MRL, it's up to the expertise, I guess.
It's up to the expertise, yeah.
Or up to the decision of the CVMP to analyze what it is safe.
Because when you say not authorized for use in animal producing milk for human consumption, including the dry period, this means that you cannot, you can never use them in heifers. Yeah. Mm-hmm. So not for use in dairy cattle. Yeah. So this would automatically include heifers, but in a way it's nonsense. Mm. Yeah. So these are difficult decisions. Next section is on the X, the study design and sampling. So also again, VSH guideline 49, X samples obtained from 10 or more laying hens at every laying time during the medication period and after the final medication. So for X and also for milk, the samples would be taken for milk in 12-hour intervals also during a treatment, if treatment is longer than 1 day, and also for eggs. And the egg samples collected, which the time range to collect eggs should be long enough so that egg yolk development is completed, which is usually 12 days. And for the egg white and yolk, it would be sufficient to have a combined sample and combined analysis. So this is in principle the sampling for eggs, and all the other conditions are the same than for the mammalians. You use the product or the intended treatment regimen and all this. And this is the study design for eggs. And so for the assessment of data, we have practically no guidance. There's no statistical method available. The alternative approach is typically used. I've never seen assessment of data based on statistical methods for eggs. And also here, products without MLs for eggs. So laying hens are not allowed to be treated, but sometimes pre-laid hens are treated, for instance with cocciostats. And they can only be treated until a definite number of age. And this is also, there's no guidance on how to assess this. Because also here you might find residues in the eggs thereafter. But you need to treat the pre-laying hens. What can you do? Not treat them, or to set a sort of to set an upper range time period before they start laying. So that's what we done in Germany sometimes. So we set the point of lay is for instance 20 weeks of age. So we would subtract the egg development, the time point for egg development is 10 days. Would subtract the treatment, the withdrawal time for tissues, which would be 2 days in this example, and the treatment period, which would be treatment over 5 days. This is we would subtract then 10 to 17 days. 17 days, yeah. And this gives you a rule of thumb calculation when you have to stop treatment before they start laying. So this has not been checked if residues are present or not. This is just a rule of thumb. I do not recommend this, but there's absolutely no guidance out how this can be done. This is how some experts did it in German authorities. It's complicated because you need to treat the animals. before they lay.
So we talked a little bit about this yesterday because there's a usual recommendation on the SPCs. I know, and that it's usually like 28 days before the laying period. You should not be using treating the hens during these
4 weeks.
Yeah, 4 weeks, which is not really based on. I'm not sure where these 28 days come from, but I guess it's some kind of a safe estimation what is done. Yeah. But I think what is going to be recommended now in the new version of the QRD template for the SPC, I think it's something like if you can demonstrate how much time, instead of giving 28 days, you are going to tell the applicants, if you can say how many days you can give a number of days which is going to be safe, then you can use that number of days. If not, you won't be allowed to use this on replacement layer hens. And then that I think that it's what going to be stated on the SPC.
Yeah, but okay.
So maybe they can use this kind of rule of thumb to calculate which would be a safe period of time. But again, I guess the applicant shouldn't have to justify this. I don't know. And if they cannot justify, then you would say on the SPC that they shouldn't use this product on future layers.
To be honest, I've never seen a study on this.
I guess it's more or less safe value, but again, it's not demonstrated because if it has a slow residue depletion, and also the milk. The eggs are going to be to be developed. It's 10 days or 12 days. I think it's for the yolk. I think, but the rest of the egg it's also started being developed before. So the whole development of the eggs can be like 20 days or so. I'm not sure, 2021. But then, if you are treating a future layer or whatever 20 days before, that residue can go into the egg, and you do not know if it's going to stay there in the egg or not. So, 28 days might be a sufficient safe time span, but you really don't know it. So I think that the approach is that the applicant shall justify this, and if not, you will not be able to use it on future layers.
How would you expect that an applicant can justify this? Do a study and show 0 in the residues?
I really don't know.
It's difficult. In this case, the animals could be treated until week 16. Yeah. So and then stop treatment.
Yeah, I guess maybe if they do some kinetic study or whatever to show that the depletion is fast or whatever, then they can say, okay, if my depletion is going to be very fast and the egg is going to be developed in 21 days, so 28 days would be sufficient, something like that. But they should demonstrate this depletion kinetic or whatever in the layer hen.
So these are problems that pop up from time to time, and there is over all these years that I'm observing the assessments, there is no final solution yet. In principle, you can use the guidance for milk also for eggs. So it's my opinion, because it's very similar, the sampling. So you have the samples from individual animals. They are not independent from each other. Milk or eggs is more or less the same, and you could use the algorithms that are presented in the milk guideline. One of these is the single time point K-factor method or whatever. But I've never seen that people are using this for eggs. Yes, in principle, it would be possible.
One thing is that usually the only commercially available withdrawal period for eggs should be 0 days, because if not, if you're going to throw all the eggs, it should be commercially it's kind of a disaster. But however, the statistical method here would be at any time point. You would calculate at each time point, you would have to calculate the tolerance limit, the upper tolerance limit for that time point. And they say if it is or not below the MRL. And then for the next time point also. And then that I guess that more or less is what they did. And this is really, as Stefan said, this is really similar to the SCPM method of the milk withdrawal periods guideline. It really does one calculation of each upper tolerance limit on each time point.
So where are we? So this is a typical depletion curve for milk. It's the accumulation of a compound. This is ENO4, ENO4 should be written correctly. During treatment, there's an accumulation of the compound in the egg, and then after treatment is typical depletion phase. Just to show you. And the depletion is different if you have a lipophilic compound, which is likely to accumulate in the egg yolk, or if you have a hydrophilic compound, which is likely to accumulate in the egg white, which is formed, as I know, 1 or 2 days before the egg is formed. So you can have 2 different depletion profiles for different pharmacokinetic or physicochemical properties of a compound. And so it's good to have also a look at the physicochemical properties of the compound before you decide on a study design for X, or before you decide if a depletion profile is reasonable. This 12-day data collection is very new. In old times, companies did collect egg data for 4 days or 5 days or 6 days. And then we came and asked, you should cover 12 days to be sure that the whole period of egg yolk development is covered.